Hey everybody, it's Kevin Mackey coming to you from the Taj Mahal at Kaiser South in the Trauma Bay. And today we're going to talk about push dose pressors. About 2 weeks ago, the county EMS agency added push dose pressors to 5 different protocols that also call for dopamine. Those 5 protocols are 8024 cardiac dysrhythmias, 8026 respiratory distress, 8031 cardiac arrest, 8067 sepsis or septic shock, and 9006 pediatric cardiac arrest. The 2 cardiac arrest protocols, you'll be using this in return to spontaneous circulation. In every single one of those, it's with a hypotensive patient that has not responded to fluid or therapy at this point. So, why? Why are we using push dose pressors? Well, over the course of the last 5 years, push dose pressors have become more in vogue in emergency departments and have moved in the pre-hospital world as well. They are a superior product with a more predictable and rapid onset of effect than dopamine. So in the event that dopamine is unavailable, there is an option to go to push dose pressors, specifically push dose epinephrine. This video is going to talk to you about how to mix that and how to administer it. The good news is all 5 of those protocols call for exactly the same thing. It's 5 micrograms to 20 micrograms, which is a half a cc to 2 cc's, over pushed dose every 2 to 5 minutes. And you're going to titrate for systolic blood pressure greater than 90. So how do you make this stuff? It's pretty easy actually. You have everything in the ambulance or the engine right now that you need. You're going to have a bag that's going to contain things. Mine says biohazard, don't worry about it. Yours probably won't say biohazard. Everything in Kaiser South is considered a biohazard, so everything goes in a biohazard bag. Don't ask. In there you're going to have a flush syringe. That's a 10 cc normal saline flush syringe. You're also going to have some sort of needle device to transfer. The needle really doesn't matter. You just need a way to evacuate the epinephrine from the 1 to 10,000 syringe. And you're going to need a label. This label is extremely important because you're going to be converting a normal saline flush syringe into a drug. So this label needs to be on the outside of that. I'll show you how that goes. And then of course, you need epinephrine 1 to 10,000. This is very important. This is not epinephrine 1 to 1,000. This is epinephrine 1 to 10,000. You don't need the needle part of it, you just need the drug part of it. Okay, so let's get going. First things first, of course, always put on your PPE. We're going to take our flush syringe, we're going to open it up, and we're going to squirt out 1 cc to give us 9 cc's of saline. I've just squirted down 1 full cc and I'm now at 9 cc's in my normal saline flush. Now I'm going to take that needle, I'm going to attach it to the end. I'm going to take out the drug portion of the epinephrine 1 to 10,000, remove the cap, and insert the needle and withdraw 1 cc. When you've done that, pull the rest of the drug remaining in the needle into the syringe so you get a little tiny air bubble at the top. And give it a couple of shakes back and forth. When you remove the needle, you can squirt out the air, and you should have about 10 cc's left in your syringe. You now have a push dose pressor in your saline syringe. Take your label, attach it to your syringe. Do not cover the numbers. I like starting where the numbers are and then wrap it around so that I can still see my cc's and how many I'm giving. Don't cover up your cc's. Guaranteed someone out there is going to do that. I've done it 100 times, so learn by mistakes. So now I have a push dose presser, and then the protocol calls for 1/2 to 2 cc's of this syringe for a hypotensive patient in one of those 5 protocols, titrating for a systolic blood pressure of 90. I guarantee you're going to like this. I've used this in the emergency department several times on patients with anaphylaxis, sepsis, and it works extremely well. It's very predictable. It works quickly. Every 2 to 5 minutes, you can redose that person as well. If you have any questions, reach out to the EMS division. Of course, I am always available to you. I have an email through all 4 of the fire agencies as well as through dispatch. Feel free to send out any questions. I hope you liked the video. Maybe more coming your way. All right. Have a great day and be safe out there.